Fixed mass and nipple or something that present in the child with the lumpy or bumpy or ulcer or a crater over the nasal radix should be evaluated for intracranial pathology. And set aside skin lesions that is rare in this children's age group. It is important to evaluate them. We have here a dermoid cyst, maybe, or you should track for the dermal sinus that communicate the dermoid cyst inside to the outside pathology, and also you should look for more complicated sincipital encephalocele. A sincipital encephalocele is a large one, and therefore you should carefully assess the MRI to find the communication with the meninges or some part of the brain that protruded through this orifice. But we have a case today that you will see. This is a simple case, not a complicated one. A 3 years old child with a nipple-like lesions around the nose of the radix referred to us, and we have evaluation with, you see the MRI. This is the T2, and the T2 you see a well circumscribed T2 hyperintensity mass under the skin of the nasal bridge, that this is the lens, and its lesions is equal to the lens equator, and therefore we should look for something that relate this to intracranial. And you see there is no intracranial pathology, but these lesions narrowed. You see at the T1, this is the inside the skull, the tumor invade, or the lesion invade the skull and makes impression intracranial. Therefore we see that this is a dermoid maybe, or epidermoid. Dermoid is more common here, and there is no brain pathology. This is the bone is black, and you see the conical shape indentation inside the surface of the bone. We plan to operate on this lesion through the seagull incision. Dr. Akbari, our ENT colleague, will tell about this. Also, you should look for other pathologies, and I will show you there is a suspected encephalocele, and it's ethmoidal encephalocele, far behind the pathology that we had. This is the mid-equator of the orbit, and therefore this is in the middle of the ethmoid bone. The patient has no CSF leak, and therefore we are not going to do anything for this, but this aware us that something's happened behind this. Maybe this lesion is complex, and you should search for every anomaly that came to your mind. And also there is a signal inside the crista galli, that this crista galli signal that is not related with any dot to our present lesion, maybe in early pneumatization of the crista galli, but you should follow this later. And Dr. Akbari will talk about the lesion, this approach that we had chosen for this patient, and we are going to operate, and you will see the surgical movie on Telegram.
Okay, as you see in this MRI, this is a 2 years old boy, and the endoscopic approach for this patient is very difficult, and we have entirely no access from the nose to the this area. As you see, this part, this mass is located between the two nasal bone of the patient, and endoscopic approach to this area is very difficult. So we use a galvanic incision between the two eyebrows, and this will cause a very minimal scars afterward.
Therefore, because the lesion is not so huge and we don't have intracranial work, we don't choose the bicronal approach for this patient, and we chose a seagull wings like this. And you will see that the step of the incision making and also the repair that end up to the best cosmetics potential outcome. Thank you very much.